Good afternoon and welcome. Thank you for joining us. It is April 1st today, 2021. We appreciate you being with us. We have a lot of updates today, particularly at the state level, but we always find it helpful to have people join and hear about what's going on locally and across the state related to COVID-19. It is also an opportunity to remind people that we have a website that really is a source of information for you that we use every day to update, and we really encourage you to go to that site, covid19eauclair.org, for more complete information on a regular basis. So for today, we'll again go through some basic data for Eau Claire County. We'll share some highlights that have happened across the state and in our community, and then we'll answer questions that the media have provided to us in advance. If media does have additional questions, please put them in the chat, and Audrey will be monitoring the chat to share those questions with me at the end, or you certainly can at the end unmute as well. So first, with our basic data, we now have 11,256 individuals that are Eau Claire County residents that have tested positive for COVID-19 since the start of the pandemic just a little over a year ago. 60 cases have been positive in the last 7 days. Continued data cleaning is happening, so the new cases this past week are at 54 cases. We have an average of a little over 8 cases a day recently. Our goal continues to be for public health reasons, so we have enough capacity to do the really critical work of making sure that those that are positive cases stay home and their close contacts know about their risk for getting COVID-19 and also stay home so they don't spread. In order to be at a place where we can do that work effectively, that 10 cases per day number really is what our goal is for this community. Of concern and of note for our community is that the last couple of days, those case numbers have been fairly high. So I'll talk about that in a little bit. But again, make sure that we are protecting the vulnerable if we get sick with COVID-19 so that we don't spread in the future. I will talk through that in a bit. Active cases now are at 78 Eau Claire County residents who are currently in their isolation time or their time where they may be able to give COVID-19 to others. We have 376 Eau Claire residents that have been hospitalized related to COVID-19, an increase of 5 since last week, and now 105 individuals still that have died related to COVID-19 that are Eau Claire County residents. As we've shared in the past, our UW Eau Claire data continues to make up about 13% of our overall cases. We do continue to get cases affiliated with UW Eau Claire, and we also know that testing is happening there regularly. It is a strong partnership. We have 16 active public health investigations. Again, that is spaces where there are positive cases of COVID-19, where we're working to decrease the spread in those spaces. The state rating for COVID activity level in Eau Claire County remains at the high level. The trajectory, or where we're going with our case numbers, is flat, and that is good. We hope that that continues. Our positivity rate is higher this week at 5%, nearly up 2 percentage points from last week, and our testing is down at 250 tests per day. We are watching both the testing and the positivity rate measures. Those are important indicators to our community about whether there may be spread happening that we are not picking up through testing. We need testing to remain high, and again, testing locations are on our website, and those are available to Eau Claire County residents. We need you to get tested if you have symptoms or if you've been in close contact with someone that is a COVID positive case, or in a situation where you don't know the status of the individuals you've been in close contact with. Our regional hospital bed space, those metrics remain good. In fact, our inpatient bed measure has been green, and our ICU bed space measure is also green this week. Community spread remains in the red. Again, many cases do not know where they got COVID-19 from at 48% this week. We continue to be tracking the measures related to getting in touch with cases and their close contacts in a rapid way. Both of those remain in the red, and we are continuing to encourage people to answer the phone call when it comes related to a case from one of our disease investigators. It's important, again, that while we have lower case numbers, we keep those case numbers low. It appears that we do have spread in close contacts happening, and we need to slow that down. So answer the phone, work with our disease investigators to keep those case numbers as low as possible. Our vaccine measure remains in the yellow. Again, we have most of our community members eligible this week, and everybody over the age of 16 starting next week eligible. But we know that there is not sufficient vaccine coming into our community on a weekly basis to get everybody vaccinated in the next couple of weeks. We will be continuing to push forward with vaccination, but do know that we remain in the yellow for this measure because of vaccine availability. As we've shared last week, our state status updates where we share state data, we are no longer doing, but please know that there is a lot of good information at the state website related to state data and at our COVID-19 eauclair.org website. A couple of announcements this week. First of all, our cases, as I said earlier, are increasing in the last couple of days. The case numbers in the last few days have been double digit, and something that we are watching carefully. Our ask of everybody is to remember that we do still have cases of COVID-19 in Eau Claire. We do have concerns about the variant strain spreading, which is more contagious. Many of those variant strains are, and can still be very impactful in this community with yet fairly low vaccination rates and populations that are at risk. If you are COVID positive or a close contact to someone that is COVID positive, stay home. We have people that remain vulnerable in our community, and with case numbers a bit higher the last couple of days, we can't afford to have people spread COVID-19, even if they're asymptomatic, to others. You may not know that someone is vulnerable in your work setting or in your social setting. So please make sure that you get tested and that you stay home if you are a case or a close contact. We also are seeing many asymptomatic cases in Eau Claire. And again, the same message is true. Get tested if you are a close contact or in any situation where you may have been exposed to someone. We don't want the variant strains to get a foothold, and if we are not cautious right now with lower vaccination rates, that could happen. And that's really what we owe each other to protect against. Updates about vaccination are, of course, our biggest updates, likely. It continues to be a critical effort by many, many community partners, including the health department, but also our healthcare providers, our pharmacies, and many others. Eligible next week, the state announced that on Monday, anyone over the age of 16 will be eligible to receive a COVID-19 vaccine in Wisconsin. No longer will there be specific eligibility groups. Anybody over the age 16 and over will be eligible. Those that are 15 and younger are not yet approved to receive any of the current vaccines. So again, age 16 and over, anybody is eligible to receive a vaccine. We know this is a large group. It's hopeful and exciting that we are able to move to this point now, but do know that vaccinators will receive still only the set of amount of vaccine that gets sent to them by the state, and it will take some time to get through that group. All of the area vaccine providers in Eau Claire County are listed on our COVID-19 website. That's an easy touch point for you, COVID-19eauclair.org, and the vaccine appointment link. If you have a regular healthcare provider, look at that site for the pathway to get to those providers, those entities that are healthcare entities in our community to get an appointment. They all have either a phone number and a registration link there, or a phone number to call. And that is a way to get appointments at Mayo, at Marshfield, at Prevea, and at the Oakleaf Network, as well as Oakleaf Hospital. If you are also looking for a vaccine at one of our pharmacy providers, you can also find a link at our website for those. And for the health department clinics, including the FEMA clinic that will be starting next week, that is also a location to find ways to get a vaccine appointment. There are many options locally. We also know that there are barriers for some in our community to get a vaccine appointment. Please reach out and help people that do have barriers. Be that community member that knows that you can help and do that work. This is important to the individual that you reach out to, but also important to our community as a whole. If you are an employer, if you are someone in the community that knows someone that has barriers, please find ways to reduce those barriers. We're also doing that at the health department, but we need your help, and we can all play a role in doing that work. Remember, vaccine is provided at no cost to the person receiving a vaccine. If you have insurance, you may be asked for your insurance card. The insurance can be billed for a visit, but even if the insurance is billed, they cannot bill you for that cost of getting a vaccine. There is no out-of-pocket cost to the individual receiving a vaccine at any of our locations. Please remember that, and please tell your friends and family and colleagues that there is no cost to getting a COVID-19 vaccine. That shouldn't be a barrier for anybody. Online appointments are one of the ways that is quickest to get a vaccine in Eau Claire County and across the state. Please help people that need help with making those online appointments, or know that you can call our COVID-19 Eau Claire call center number and they will help as well. That number is 715-831-7425. We also want to remind people that if you've made a vaccine appointment at any of the providers, please go to that appointment. Again, make one appointment and keep that appointment. It is so important for vaccine providers, with precious vaccine doses we have that do expire if we don't use them within a limited amount of time, to have a reliable number of people coming in to get those doses through the appointments that they schedule. Please make an appointment and please show up for your appointment. Health department clinics, I'll give a quick update on. Again, many choices, but one of those is the health department. We've been holding clinics at North and Memorial High School. We have been super thankful for the partnership that Eau Claire Area School District has given us, and those partners, particularly at North High School and Memorial High School, have given us. They have been amazing in this effort to get vaccination done at those two locations for our community members, and we send an enormous thanks to them. We will continue to have smaller clinics at those locations to give our planned second doses to people that received their first dose at Memorial or North. So if you received your first dose at that location, you will get a second dose at the planned intervals at those locations. Please make sure you show up for your second dose at those planned clinic dates. Beginning next week, April 8th, most of our appointments will be scheduled at UW-Eau Claire Zorna Arena through that process. FEMA, our federal partners, and UW-Eau Claire are also partners on that site at Zorna Arena. Sign up for those appointments will be available shortly. Right now, you can get on a wait list at the state registration site. That's vaccinate.wi.gov. Again, there's a link on our website for that way to get on the wait list for those Zorn clinic appointments. You will get an email when those appointments open up, and then you can make an appointment. That'll be available soon. We are hoping that the state releases in the next several days a direct way to get an appointment through that site. So again, vaccinate.wi.gov will be the way to get an appointment at the Zorn Arena FEMA clinic location. The health department will also be doing additional clinics and additional sites across Eau Claire County to get to populations that may have more challenges or barriers in getting to the site at Zorn Arena. So we are working on that as well, clinics in our rural areas, as well as with specific population groups. Do know that that work will continue. And if you have any questions about that, please do not hesitate to call our call center number. We are making progress. There's a lot of hope about where we're going with vaccination. Now there have been 50,457 total doses given. So 50,457 total doses, an increase of more than 6,000 doses since last week. Again, with all our community providers of vaccine contributing to that increased amount. 34,930 individuals, almost 40,000 people have gotten at least one dose, and just a little over 24,000 people have completed the entire series, so are fully vaccinated, 23% of our total population. 70% of those over the age 65 and older in Eau Claire County have completed their vaccination series. Again, our most vulnerable population for hospitalization and death with COVID-19. Close to 79% of those 65 and older have gotten at least one dose. Really good news. We still have room to improve, but very, very good news for Eau Claire. We also are sharing today that we are releasing the revised version of our community expectations document. You may remember that that document last came out in January with updated expectations at that point because of improved case numbers. We now have lower case numbers yet than January and increasing vaccination. We have hope with where we're going, and we see progress in how we are moving forward with our basic expectations related to really supporting success with COVID-19 in our community. We also know that with that progress comes a need to continue to be clear that we aren't done yet. We need to continue to work together to keep our case numbers low and keep our vaccination rates going up. So it's an ask of the community, an expectation of the community and of individuals across this community to continue to partner with us to follow those basic mitigation strategies so we protect one another from not having more cases and not having the variant strain get a foothold. We are also expecting our community partners and our entities that have gatherings and have public spaces to also follow basic expectations. Those include the continued need to have face covering use, physical distance, staying home when individuals are sick and getting tested if they are exposed, and determining a plan at an individual level to get vaccinated as soon as you can. In public spaces, it includes having policies in place that screen and prevent anybody who may have symptoms from entering those public spaces to avoid spread, and supporting employees that are required to quarantine and isolate. Public spaces are expected to remain at 50% capacity. As long as that distance can be maintained, that 50% capacity is what is expected. For anyone holding a larger gathering, the expectation is to not only be at that 50% capacity, no more than that level, but also to consult with the health department if there is, if there's a size limit over what we describe in the expectations document, and I'll walk through that in a minute, in order to really slow down spread of communicable disease of COVID-19. So again, the new expectations document doesn't name that events at a certain size can't happen. But again, if you are at that 50% capacity and are looking at having an event of a larger size or a larger risk, then the expectation is that you talk and walk through that with the health department to really work together to decrease the risk of those events. Named in the document is that indoor gatherings with non-seated activities, so those things such as a festival, a market, or a wedding reception with non-seated activities, 250 or more attendees at that level. If you are exceeding that, then again, consultation with the health department using a specific tool that is on our website would be expected. For indoor gatherings where individuals are seated, that is at 500 or more attendees. Outdoor gatherings with non-seated activities, again, a concert that doesn't have seats, those kinds of activities that may be outdoors, those are at now 500 or more attendees. And then outdoor gatherings with seated events, again, similar type of events that may have seated locations, that is at 1,000 or more attendees, would be expected to walk through a basic plan to decrease risk. So again, that's all outlined in the documents that are available on the website. It is really a shift for us in naming that there are basic expectations. We expect those basic expectations to be aligned specifically with local, state, and national standards that are also listed very clearly on our website, which ones are to be followed. And we've also added to the frame progress. So our plan is to continue to move forward with providing a more normal experience in the community in those public settings and in gatherings over time. As vaccination rates go up and as disease rates remain flat and the trajectory does not increase and the numbers not increase, we expect by the beginning of July to be at a space where we will no longer have capacity limits and where we hope to have minimal mitigation strategies aligned with the state and federal expectations in place in this community. So a lot of hope, a lot of need to work together so we don't go backwards, and a lot of need to just continue to do those basic things to not only protect us as individuals, but to work together to protect one another, especially those that are most vulnerable in this community. The health department will not be approving any plans for any specific gathering or event through this process. We are planning to work with event venues and event hosts, and we've been doing a lot of that already, to make sure that there are safer environments for everyone involved. Our staff is providing and will continue to provide one-on-one feedback for specific plans related to large gatherings. We will talk you through your questions related to those gatherings. And the expectation is if they are larger, more at-risk gatherings, as I just described in the indoor and outdoor spaces in Eau Claire, that we would walk through those with you. For those smaller gatherings and less risky gatherings, we have checklists on our website that can help you as you develop plans to make things safer for those people that will be gathering with you. We are counting on all people across Eau Claire, whatever the gathering type may be or whatever public spaces people may be entering into, that they're doing it in ways that protect one another and that we continue to do that. Again, we are updating our website with both the expectations document and the plan for gradual reopening with capacity limits for all spaces. We're excited about this. We're excited about the hope we all have, and it's a big step forward. We are counting on people that are eligible getting vaccinated. We need that in order to keep progressing. We are also counting that people that haven't been vaccinated, people that do interact in close contact situations, are making sure they're not spreading COVID-19 and creating situations and environments where the variant strain can take a hold. We need to count on one another that we prevent that from happening. All of this is at the COVID-19eauclaire.org website. and is in our Community Expectations Prevention tab. So please go to that Community Expectations tab. You'll find a lot more information there. We're trying to simplify things. Both documents are much shorter than previous documents, and we really hope that people go there as a reference. We also want to talk through the requirements around face coverings in Eau Claire County. Yesterday, the Wisconsin Supreme Court ruled that had a ruling that struck down the state emergency order, and in that also struck down the from the emergency declaration, the emergency order related to face covering use at a state level. There is still a critical science-based reason for us to continue to wear a face covering in public spaces when we cannot maintain distance and when we are in those risky situations that could spread COVID-19. We need this strategy to remain in place despite it ending at a state level with that order. The variant strains and our low vaccination rates make it continuing to be a basic strategy that the CDC and the state name as critically important. Back in February, the Eau Claire City Council and the Eau Claire County Board did pass a local mask ordinance. This is not an order. This is an ordinance coming from those two legislative bodies, the Eau Claire City Council and the Eau Claire County Board. As an ordinance, like every other ordinance, there is the ability to enforce that ordinance. But again, our goal with all of this is that we see the value in protecting one another. We educate when we encounter situations where individuals are making complaints to the health department, and we follow up on those complaints. But again, we really want people to understand that this is not about what you have to do, but this is about what we all want to do and need to do to protect one another. The ordinance, the Eau Claire City and Eau Claire County ordinance, did go into effect yesterday. It remains in effect until June 30th or until the Eau Claire City Council or the Eau Claire County Board change that. It does have very similar requirements to what the state order had. It does add the additional requirement that public spaces and entities do need to post a sign on their door indicating that there's a requirement for a face covering in that space. There's an example of the type of sign that could be used at our COVID-19 eauclaire.org website under print resources. Many places already have this on their doors, and thank you to those places that are working hard to protect people that are coming into their public spaces. We appreciate how much you care about the community. So now questions from media I will walk through that came in advance, and if there are additional questions in the chat, remember you can put those there. First of all, is it safe to drink alcohol before, after, or in between COVID-19 shots? An article from Forbes says that some doctors in other countries are saying to avoid alcohol around the time of your vaccination, but is there any official guidance at this point? At this point, to our awareness, there is no official guidance from the state or CDC on this issue. We do know that there is information generally available that high levels of alcohol can impact your immune system, and that certainly can make a difference for any vaccine, including the COVID-19 vaccine. And it also makes you potentially more susceptible to illness. Those things are things that people should care about. We know that there is important research that is always happening, and as we hear more about this, we certainly will share it with one another. There's a lot we still need to learn about all of these topics. For those that do choose to drink alcohol, remember moderation is important no matter what the situation is. Certainly, alcohol use at the time of vaccination is not recommended for lots of logical and simple reasons. First of all, most people have to drive to their vaccination site. It's also really critically important that an individual that is at a vaccination location can make clear and informed decisions about getting vaccinated. And post-vaccination, we want to make sure people can monitor their symptoms effectively and be able to report on those if they are serious. So again, more research to come, I am sure, but please be smart in your use around alcohol at all times, and be smart in the case of COVID-19 vaccination. Additional question, Pfizer now says its vaccine is effective in children ages 12 to 15. Will it be offered to that age group soon? It is exciting news that there is rapid research happening for younger age groups. The current eligible populations to get vaccine, again, are those age 16 and older. Pfizer is actually the only vaccine that is eligible for 16 and 17-year-olds. So the two other vaccines are actually only available for those 18 and older. It is exciting to have research in process for younger age groups. Pfizer is first out of the gate with having that research move forward rapidly, and it appears that they will soon be able to move forward with seeking approval for vaccination for those under the age of 16, that 12 to 15-year-old age group. It has not yet happened. The emergency use authorization for Pfizer remains at 16 and older. As soon as it's approved and the emergency use authorization is approved and the ACIP, the governing body at the federal level, approves this, we will absolutely be sharing that. We also know that the two other vaccines that are currently available are doing similar research, and it's progress, and we will share that news as soon as it's available. An additional question, now that the local face mask order is in effect rather than the state order, how does that change enforcement, if at all? So really, the enforcement process remains the same. It is a different type of enforcement at the end. This is a citation at a city or county level, so a little bit different mechanism at the end of the process. But again, we have not gone forward with anything like that with the state order at this point, although we could. With the local order, that citation process is possible, but the health department has been utilizing tools of education and persuasion to really continue to help our community really approach this as something not about that we have to do it, but that we all want to do it to keep each other safe. If you have a complaint or a concern in an ongoing way with a risk to community spread, please call our COVID-19 hotline. That number is 715-831-7425. We'll follow up. We also follow up on complaints that we get from other entities like law enforcement. Our staff's goal continues to be education and working together to keep our communities safe. Question that the order calls for required signage to be displayed. Are there minimum requirements that the business must adhere to so that they can meet that part of the order? Again, both the City of Eau Claire ordinance and the Eau Claire County ordinance, it's not an order, it's an ordinance, require that buildings with public access have a sign. And that sign needs to say that face coverings are required. We don't have a requirement in the ordinance about what that sign looks like. We do have an example on our website. So again, as I said earlier, any building that doesn't have a sign, they can print an easily available one, COVID-19 Eau Claire website under print resources. We hope that businesses see the importance of making that clearly visible and available to everybody, and a clear signal to the community that you're taking it seriously to protect people that are coming into your spaces. There is an opinion piece in the USA Today saying people who have had COVID should consider getting only one vaccine for now, plus that one dose plus antibodies from the virus equal more protection than both doses. Is that something that the health department would recommend, is the next question. For the 2-dose vaccines that we currently have available to us, Moderna and Pfizer, the guidelines for use by the state and by the federal government remain 2 doses are the best protection. We continue to follow that directive that if you get a first dose, you are expected to get a second dose, and that is really the best protection. We know supply is increasing. We shouldn't have the concern about saving those doses for others at this point in time. So really, We are following those state and federal rules, and 2 doses is what we are really looking at. A question about local orders that were put in effect because of the state Supreme Court ruling, again, presuming that this is the local ordinances that were put into effect. Since the rollout of the vaccine has been strong, for those in the community that become fully vaccinated, why do we need this? Why do we need to continue to wear a face covering when people are vaccinated? So at a federal and state level, the wearing of a mask remains even for people that are fully vaccinated. We are getting a lot of good news about the potential that may change in the future. In fact, the CDC director did recently this week name that research is coming in and that it does appear, now that we have more time, to look at vaccination and whether not only does vaccination help with hospitalization and death, but does vaccination help with spreading of COVID-19? And that's really the question that we need definitively answered in order to really be comfortable at a state and national level, changing the guidance that currently exists to wear a face covering until we know that that is not needed with vaccinated individuals. We are following that research. We are continuing to make sure that we are following state and national guidance on this topic. So right now, if you are fully vaccinated, the expectation in public spaces is that you are continuing to wear a face covering. In our space at the health department, for example, many people are vaccinated, and we still have an expectation that in public spaces, and especially if other people are present in those public spaces, that we are wearing a cloth face covering at all times. I know sometimes some people wonder why I talk to you without a cloth face covering on. I am in a room by myself with the doors closed. It is an enclosed space with no other people and no exposure risk. When I walk out of this room, I immediately grab my cloth face covering and put it on. So again, everybody, vaccinated or not, wear that cloth face covering when you're in those spaces where risk is present. We need layers of protection is also the other basic information. Vaccination alone is critically important, but not sufficient. We need testing, we need distance, we need vaccination, and we need cloth face coverings. We know from a year now of really good research and really good data that those things, testing, vaccination, distance, and face coverings, will make an enormous difference in this community. Next question is, does the health department know for how many weeks or months the FEMA vaccination site at Zorna will be in operations? At this point in time, we understand from the state that the tentative plans are through the middle of the summer. As soon as we hear something more definitive, we will definitely let the community know. Right now, we will have 3,500 doses available at that site for the foreseeable future. Again, you can watch our website, but we will continue to work with the state as well as our FEMA partners on that site. A question by one of our media sites that shared something that they heard from a reader in regard to the over age 30 group who may, or in regards to those Eau Claire County residents who may have been reinfected with COVID-19. We estimate that at about 30 people. Does the health department know if any of those people received a COVID-19 vaccine before the reinfection? We don't have that data currently available, but it is certainly something that we are working with the state to continue to track and link the records of vaccination to our disease investigation records. So as soon as we have more information about that, we will certainly share that. It's an important part of learning with vaccination. And then how do you think the vaccination clinic at Zorna will affect the community? First of all, I hope it gives people a lot of hope. I hope it also gives people a lot of opportunity to, again, get a easy to access vaccine. Just going online, getting an appointment and coming in with a large volume of doses available, hopefully will make it easier for many people to get vaccinated. Again, we know there are many vaccine providers in Eau Claire County, and all of them will be getting vaccines, so use all of them, but Zorna will be another resource available to people. We'll be doing 700 doses a day, and within 3 weeks, that'll be 1,400 doses a day with our second dose clinic starting 3 weeks out with the vaccine that we are receiving. We are a regional site with our Zorn Arena FEMA site, so we will be advertising and pulling in partnerships from across the region as well. So at this point, are there other questions that came up during the chat, Audrey?
There are no other questions in the chat box. Is anybody who is on the call right now interested in unmuting and asking a question directly?
Yeah, this is Sarah from the Leader Telegram. Can you guys hear me? Awesome. I just want to make sure that I'm understanding what specifically is changing in the community expectations document. It sounds like what is changing is any event indoors over 50% capacity will be required to consult with the health department, and there will be new benchmarks for the size of indoor and outdoor gatherings that must consult with the health department. Is there anything else that is changing in the new community expectations document? And also, will there be any penalty or enforcement for groups that don't consult with the health department if they decide to hold, a big gathering outdoors?
Thank you for those questions, Sarah. So there are a couple of simple answers to your question related to what has changed, and I'll walk through those briefly, but certainly invite people to look at the document itself. The document frame remains very similar in look, but it's much shorter. So the individual expectations and the gathering and public spaces expectations are many fewer and now reference to state and national standards. So rather than coming up with Eau Claire specific standards around public spaces and around public gatherings, we've really normed those to the state and federal language. So there are links on our website that we refer people to. So for example, if you are a sporting event, you are expected to look at those sites that are considered the sites for sporting events at a CDC level, at a state level, and follow those basic expectations that are listed there rather than looking at just our document. So that's one change. So again, fewer overall and a reference to state and federal language. So there's not that confusion about what's different between Eau Claire versus what's happening at the state and federal level. The other change is that previously in the document related to gatherings, there was a whole section that was related to gatherings, and the expectation was that there was not an ability to have a gathering over a certain size. And that was listed as a very distinct and separate section in the document. So you may remember previously at one point we were at gatherings no larger than 10 people. That in the document in January did go up in numbers for indoor and outdoor gatherings, but it was a very distinct cutoff. What changed in the current expectations document is that while 50% capacity remains, so if you are a individual, just using an example, that is planning in an indoor venue, a large wedding, the venue capacity of 50% remains. But if that venue is of a size that the capacity number is over the number of individuals that is listed in the document, and I'll pull up my example so I can make sure I use the right framework. But in that indoor setting, if this is a wedding that's only got seated activities, so there's no dance, there's no other activities, and the capacity in that venue is 2,000 people as an example, so 50% would be 1,000. Our document right now says indoor gatherings with seated attendees, anything over 500 would be expected to talk through their plans with the health department. Using the wedding example, our intention is to work with venues rather than individual events, an individual wedding, to talk and walk through that. So we have been meeting with those venues that, for example, do those kinds of gatherings to really talk and walk through and have at a venue level those conversations. If it's an outdoor concert that doesn't have seats, again, the expectation, if there are no capacity limits in that type of event, so 50% doesn't really apply. Again, if it's an outdoor gathering with more than 500 people, so a concert that is planning to have 1,000 people or more attend, or anything over 500, would be expected to walk through with the health department their plan for making sure that individuals could be safer from the spread of COVID-19. So instead of saying it can't happen in that example over 500, our new guidance says that with a conversation with the health department to decrease risk, there can be that move over that number. So there's a bit of complexity around that. It's not just a yes and no answer, but it does give opportunities to really work on our primary goal with this document to decrease risk. So it made sense to focus on risk and continue to focus on risk and not focus just on a number. So those are the primary changes. Those are outlined on our website and outlined in that progression tab. It also names very explicitly that we will minimally be monthly coming back to our expectations document and naming changes. If we are continuing to move forward with vaccination rates improving and flat numbers of cases, we expect to move from that 50% capacity rapidly to full capacity by July. That's our goal. I think, Sarah, you may have had an additional question that I didn't fully answer, so do remind me if you did.
Sure. You touched on it, but I was wondering if there's going to be any penalty or enforcement for groups who don't consult with the health department if they decide to hold, say, a 1,000-person wedding reception outdoors. You did say that the venues is who you're primarily talking to instead of individual couples.
Absolutely. What will happen, just like previously happened with our expectations document, so no change there in our process. If entities are not following the basic expectations that have been shared broadly in our community, the new expectations document again will be shared broadly on our website, but also through all of the usual channels of sharing. If those expectations are not followed in public spaces and with public entities and venues and organizations that are planning large gatherings, we will follow up if we get complaints. We will follow up with a verbal conversation with the health department. We will follow up with a very clear letter documenting not following those expectations. And certainly if we are asked by people that are concerned, we will be naming when events are not following those basic expectations. Our goal continues to be that our venues, our public spaces, and those people planning gatherings are seeing the shared interest in having a safer community and a safer event. And we are enormously fortunate in this community that we have had great partnerships. Our Chippewa Valley Economic Recovery Task Force and our work with the Chamber has been outstanding. And I don't know if everybody in Eau Claire realizes that the environment for collaboration and partnering here, while we've had bumps in the road with individual entities or individual organizations, overall has been absolutely a partnership. And I really want to lift up that schools and businesses and entities and organizers have really, for large measure, framed their actions around wanting to keep the community safe. And this can't be about an expectations document that is about one individual or the health department naming what needs to happen. This needs to be shared, and it has been our approach from the get-go to get that message out and to work with partners to have those expectations out there, to share the science and to make sure that we are working together to keep walking forward with good science and shared value to have a safer community.
Are there any other questions from our local media partners who are on the call?
All right, thank you for joining us again today. Again, COVID19eauclair.org is the website. Please go there. There are lots of updates. Call center is 715-831-7425. Again, we never know what the updates will be in a given week. We will be back next week to share the state updates, the local updates, and that briefing will be a week from today. Thank you very much.